Hello, Chase Brexton. We're here at the Mount Vernon Dental Department with Dr. Woodward so he can give us a few updates.
Carlos, I thought we were here to start your root canal today.
No. According to Dr. O, my teeth are perfect at the moment.
Well, I'm glad to hear that you're seeing Dr. O on a regular basis like a good dental patient. Then let's get to your questions.
All right. How has dental grown in the past year?
So a couple things come to mind when I think about growth for dental this year. One, program growth, and two, staff growth. We were fortunate enough this year to be able to grow our preventive children's health care system out in Columbia. So we now have Head Start as part of that program. This is about 275 to 300 children, all under the age of 3, who we're seeing twice a year for regular preventive services, just like if they were to come to the dentist office. So they're getting a checkup, they're getting a fluoride varnish, and they're getting their teeth cleaned. So this type of collaboration, when we can deliver preventive services to children in a non-clinical setting, is a win-win for everybody. The children really benefit from these services. The parents, it's very convenient for them. They don't have to make a dental appointment. For the organization, we have a little over 1,000 billable visits for this, and our compliance for the appointment is really great since we're in another person's facility. And since we're in another facility, the overhead for us is also really low. So like I said, a win-win for everybody whenever we have an opportunity to grow this kind of program. The other growth this year comes from staffing. We were fortunate enough to be able to hire a new staff dentist this year. And you might think, well, you hired a provider. How is that a really big deal? But we're one of the smaller clinical departments here. We have really only 4 staff dentists, including myself. So getting a 5th dentist on board makes a significant impact in the growth for the department. The last time we hired a new dentist for the dental department was over 7 years ago. So our dentists manage multiple schedules here. So having a new dentist on board gave us greater access to care for the patients and really helped with the visit volume for the site.
All right. Thank you. Now, what's in store for the coming year?
So the coming year for dental is all about Glen Burnie. We have all fingers crossed that everybody in the office and toes, that everything comes together and lines up for Glen Burnie expansion in 2017. The plan is to have a 4-chair dental suite in Glen Burnie with a full-time dentist and a full-time dental hygienist. So some of that ball is already rolling, and we hope it just continues and that the dream of this expansion into Glen Burnie comes to fruition this year. We're hoping that even by the end of this year, December, we might be close to opening.
All right. That's really good news. Now, what dental care tips would you like to give and share with our viewers?
So the best tip I can say is visit your dentist twice a year. Because prevention is the best medicine, number 1. Number 2, if we find something, we catch it early, so it's not a big deal to fix. Number 3, if you happen to be an employee here, we have a great insurance plan for dental, but we also give you an additional benefit, so we cover your copayment for all your preventive services. So rather than just being covered at 90%, you're covered at 100%. So visit your dentist twice a year, and if you're an employee, you are certainly welcome to any dental facility in any of our offices.
Thank you, Dr. Woodward. Now we're going to go with our colleague, Jermaine Wyatt. Have a good day.
Thanks, Carlos. I'm here with Nate, and I'm excited to talk about all of the wonderful things that's been happening in behavioral health.
Great, and I'm also here to give some updates on the LGBT Health Resource Center. So, Jermaine, thanks for coming down to the Resource Center. What I'd really like to talk with you first about is integrating behavioral health into medicine. We keep hearing a lot about that, but I'm not sure we all fully understand what that means. Can you explain that for us?
Absolutely. What that means, Nate, is that when patients come to our clinic, that they are not only seeing their doctor and we're addressing their health needs, but we're also looking at them in terms of the whole patient. So we're addressing their psychological as well as their health needs during their visit. So what that means is that what you'll see over time is that our behavioral health providers are in the pods working as a part of the primary care team with the doctors, working with our patients to get them into behavioral health. And as a result of that, what we should see is we should see some better health outcomes. So patients who come to medicine that may have an elevated A1C that has an interaction with a behavioral health consultant who's in the pods, if we're able to get them in treatment over time, what we should be able to see is that those A1C levels would be able to be stabilized over time.
So you're almost talking about, using behavioral health. Is that the same to address some of the other health needs? Is that different than BMed?
Absolutely, in a way. So our BMed is really focused on health psychology. Okay. So our behavioral health providers who are integrated will be able to address our patients who are coming in that have unmet behavioral health needs. So oftentimes we do have patients who come to our health center that have unmet behavioral health needs that walk out of our doors that don't receive care. So having a behavioral health provider assigned to the pod gives us an opportunity to capture those patients when they're coming in to our clinic and getting them upstairs into behavioral health so we can address their behavioral health needs. Our behavioral medicine providers are health psychologists who really focus on chronic disease and really focus on behavioral change with those patients to help them reach optimum health.
So this is really about doing something more for the patients and making more services available to them?
Absolutely. Absolutely.
Great. So, this is a big change in how we've done things, but I know there's been a lot of changes in behavioral health and a lot of successes that have come with that. So can you share some of what those successes are that have been happening recently?
Yep. So absolutely. So over the last 8 months, we actually have increased our visit volume by 75%. So our providers have really been doing a lot of hard work to capture those patients that are in primary care that need to get in. The other thing is that we have been working a lot on our access to behavioral health. So about 8 months, it took about 32 days for a patient to get into behavioral health. And we have an access manager who's been doing a wonderful job through a quality initiative where we've actually been able to get that down to about 16 days, and we're continuing to work on that. The other things is our quality metrics are improving, so there's been a big emphasis on quality. So I'm proud to say in terms of our treatment plan, we have been sustaining our treatment plan completion rate at 100%. So that's exciting. Another thing is looking at our growth. We were recently awarded $300,000 to expand our substance abuse program services in Glen Burnie. So we're excited about that launch in August. So a lot of great stuff been going on in behavioral health. I'm really proud of the team.
I'm proud of them too. So, we're down here in the LGBT Health Resource Center, and I have my thoughts on why and how we've been able to expand behavioral health into this second floor location at Mount Vernon in the LGBT Health Resource Center. But I'd love to hear your perspective on why this was needed for the LGBT community and how it's different from all the services or the same as the services upstairs.
Absolutely. So as we both know is that, LGBT patients are traditionally have experienced being marginalized. And one of the things as our organization have grown, it is important that we create a space and a safe space where patients who may not feel safe coming up to the 5th floor may have an opportunity to come to a space where they are comfortable to receive their care. For me, it's about providing access to patients. So it's about looking in our organization of where do we have opportunity to grow, where do we have opportunity to meet the needs of patients who we're not meeting, who is marginalized. So it was exciting about using this space to create some opportunities to work with patients who really want to come through the purple door. So we're really excited about that.
Yeah, I really feel the same way because, it's not like the 5th floor I mean, the fifth floor is very welcoming to everyone, but there are some folks who just really have a hard time engaging with healthcare, and the things that we can do to take down those barriers by, people may come in for a program that we're doing in the LGBT Health Resource Center or some programmatic complements to the medical care, and then we work to connect them to a level of service that hopefully connects them to all of Chase Brexton as a whole. Be that if they enter and then start to engage with dentistry or reach out to us, and then we are able to identify a behavioral health need that we say, hey, we think, do you know that this is available here and right around the corner from where they might be entering into the things we have going on here. So kind of turning to trans care, I was hoping to share with you some of the things that we're planning on doing. Would you like to hear more about it?
Absolutely.
Okay, so just so folks know, what we're really hoping to do around trans care is, as Chase Brexton continues to grow, we realize that we probably do not have the resources or ability to get everyone who works here to be an expert in trans health care. And quite frankly, from a patient's perspective, people don't necessarily want to be the first patient that a provider ever sees. Providers are coming to us, with years of experience and maybe not ever having taken a patient through the transition process. It's not something that's taught in any med school. So what we're really looking to do is to try and create kind of a two-tier system so that we really have people who specialize in trans care across the lifespan. Folks who specialize in youth and adolescents, as well as folks who specialize in adults, to really help them through the transition process. Now with that though, those specialized folks would be able to help people very specifically, but we want to make sure that every patient who comes to Chase Brexton has a great experience. So for the folks who are not the specialists, what we're looking to do is develop some level of competency around providing general medical care. If you're coming in for an earache, you should have a great experience. But if you're coming with a very stable hormone regimen, you might be able to just stick with a primary care provider who has less experience. But if you have a complicated regimen or you're in the process of starting transition, let's get you connected to someone who really specializes in that. So that's a little bit of how we're starting to approach things. Deb Dunn has been working really hard with Kate Bishop to try and map this all out, and with the help of all the other providers, and integrating this through to behavioral health to really make sure that we set up a program that's successful.
Thanks, Nate. That was a lot of exciting information, and I'm really looking forward on your journey through the Purple Door. Now to you, Deb Thomas.
Thanks, Jermaine. It is my esteemed honor to introduce Chase Brexton to our new Chief Medical Officer, Dr. Avian Tisdale. Dr. Tisdale, thank you so much for being here today.
Thanks, Deborah. It's a pleasure to be here.
Well, as we know, the climate of healthcare is always evolving. Perhaps you could give us some information or ideas on how Chase Brexton is navigating these ever-changing waters.
Sure. I think there are two priorities that have been at the top of mind for senior leadership. The first is making sure that we have a complete leadership team that's really positioned to keep us ahead of those changes, not behind. And our CEO, Richard Larison, has done an excellent job making sure that we recruit all of the right people to the right places. There are lots of moving parts and people in an organization that has multiple sites and is as comprehensive and multidisciplinary as Chase Brexton. I think we're all here now and we're ready to do what needs to be done. Second, I think that there is a renewed focus on patient care and quality, and those are things that we're taking a good hard look at to be sure that we're on the cutting edge of quality care.
Well, that's good to know. It's really important that we have the right leadership in place at the right time, and it's awesome to know that Chase Brexton is right there. So as our new Chief Medical Officer, what's on your agenda?
So I have two main, very broad-scoped priorities. The first is continuing to promote an integrated care model that truly takes a look at making sure every patient receives every component of care they need when they need it. The second is making sure that we recruit and retain the best possible providers in the region. All of those things really materialize to make sure that we come out with the outcomes we're looking for.
Dr. Tisdale, I know all the staff and employees are really excited about you being here, all the changes that we're going to make, and the ways that we're going to grow together. Why don't you give us a few ideas for what we can do to help grow the organization with you?
I think it's really important to stay connected with us. Follow us on Facebook, send us messages, stop us in the hallway and tell us what your thoughts are. Those are really easy ways for us to stay connected with what our patients need most. We take every piece of information we get from our community very seriously, so every opportunity you have to give it to us, please share. That's how we grow.
Thank you, Dr. Tisdale. We appreciate your input and your contribution to our organization, and we look forward to working more with you in the future. Now we'll send it over to my colleague, Shanae Murray.
Thanks, Deborah. I'm here today with Joe Favre. He's our Director for Real Estate and Facilities for Chase Brexton Healthcare. Hi, Joe.
Hey, Shanae, thanks for having me.
Thank you for joining us today. Well, we've seen so much growth and expansion for Chase Brexton. Could you give us an update on all of the excitement and activities?
Hey, I sure can, Shanae. Well, I'll tell you, for me, it's been nonstop. I came on board in 2014, the middle of 2014, and we opened up our first clinic down in Glen Burnie, and it's been nonstop ever since. We've got about we opened up 9 exam rooms down there at the end of that year, and again, we moved then into 2015, where we expanded our Randallstown clinic. We also built an LGBT resource center right here at Mount Vernon. By the way, that LGBT resource center is one of a kind, and the only one that we're aware of in the region. So we went back to Glen Burnie, added more space there, added space in Randallstown, expanding our behavioral health and addictions program, our case management program, as well as additional exam rooms in Randallstown. By the way, when we did the LGBT Resource Center, we also added space for our Human Resources Department that was very much needed.
That's great, Joe, and how exciting. Have your crews unearthed any strange findings?
Well, not really related to expansion, but we did open up an entrance, if you will, to a humongous safe right here at the Mount Vernon Clinic. And this building used to be the Monumental Life building, and we've always known the safe was down there, but now you can actually tour it, and it's absolutely huge, and the type of engineering that was involved with that is pretty amazing.
That's great, Joe. What's next on the project list?
Well, we're currently expanding in Columbia, again, adding additional exam rooms. I think at the end of the day, we're going to have 22 exam rooms serving that community. The Columbia site, as well as Glen Burnie and Randallstown, and of course here at Mount Vernon, as far as I'm concerned, they're state-of-the-art health clinics that offer all the services one could wish for.
And what's next on the horizon?
Well, we've got a complete Columbia. Okay, we want to get that up and running by June, and then we're looking at my favorite spot, Glen Burnie. We're going to go back there. I've been back there twice for expansion. Now we're going to expand on the 5th floor with our behavioral health and addictions program, as well as a pharmacy. And on the 4th floor, we're going to have a brand new dental clinic. Again, state of the art.
Great, Joe. Is there anything else that you'd like to add?
Well, again, it's been so exciting to see the Chase Brexton grow and expand and to help the community. But I'd like to thank everybody that cooperated, with the facilities department. I'd like to thank the facilities team, and everyone at all the clinics for their help and cooperation and understanding during some, messy construction times.
Thank you so much, Joe. Well, next we have a board moment from our board chair, Carolyn Kennedy.
Hello, Chase Brexton staff, managers, and leaders. I hope you have been enjoying this segment of the Chase Brexton News Network. Please allow me to introduce myself. My name is Carolyn Kennedy. I have been with the Board of Directors since 2009 and am currently the chair of Chase Brexton's Board of Directors. On behalf of all members of the Board of Directors, I want you to know that we appreciate and value everything that you do to make Chase Brexton an outstanding community health care center. As you can see, our organization has been changing in many ways. For example, since joining the board of directors in 2009, the board has hired a new chief executive officer, Richard Larison, who has brought on senior staff to implement new practices based on the board of directors' goals and policies. Also, recently, we've implemented longer days of operation and a Saturday schedule. We've taken steps to implement a broader integration of health care and population health. We've further broadened the LGBT services by partnering with SAGE and opening the LGBT Health Resource Center. Over the next several months, you will learn and experience more change as we continue our strategy to remain viable and sustainable in 2020 and beyond. The board of directors needs you to stay on course and support the strategic imperatives as determined by the board of directors and implemented by our CEO. I encourage you to continue the outstanding work that you, the face of Chase Brexton, do for our patients and our communities. Thank you for all that you do every day.